In this video, we will be discussing the side effects from prostate radiation therapy, namely from external beam radiation. The side effects you'll experience during radiation range from acute side effects. These are side effects that the patient feels during treatment, to late side effects. These are also known as long-term side effects, which are side effects that happen many months to years after the actual radiation treatments. Acute side effects mainly involve urination. One of the most common side effects is urinary frequency. Most patients are urinating every 1 to 2 hours during treatment, which is expected. If you are urinating more than once an hour, please let your radiation oncologist know as soon as possible. Patients may also experience dysuria, which is burning with urination. Patients may also experience nocturia, which is urinating more often at bedtime. Most patients urinate 4 to 5 times during bedtime. If you urinate more than this, please let your radiation oncologist know. Patients may also develop a sense of urgency, which is an urgent need to urinate. Patients may also notice a weaker stream of urine. The weaker stream of urination is due to the inflammation in the prostate. You see here on the picture on the left, the normal prostate, there is good urinary flow through the urethra. If you look at the picture on the right, this is an inflamed prostate that has enlarged in size. You will also see that the urethra is now constricted, as highlighted by the circle. This is illustrating poor urinary flow out of the prostate. There are medications we can give you to help open up the urethra to restore urine flow. In terms of acute side effects, there are also side effects to the rectum, as the rectum does receive a low dose of radiation. These side effects include diarrhea and loose stools. If you're having more than 3 to 4 bowel movements a day, please let your radiation oncologist know. Patients may also experience bleeding and flare-up of hemorrhoids. If you have persistent bleeding, please let your radiation oncologist know. This is a graph illustrating the timing of the severity of urination side effects related to the radiation treatments. You will notice that the first 2 weeks, there are virtually no side effects during the radiation. After the second week, the side effects slowly progress until the end of treatment. At the end of treatment, most patients are only experiencing mild to moderate urination side effects. Very few patients develop severe urination side effects. The side effects persist for a couple of weeks after the radiation and slowly start to get better over the following 2 to 3 months. This is a graph illustrating the side effect profile in terms of rectal side effects. As you'll notice, the first couple of weeks, there are virtually no rectal side effects. Starting at the end of the second week, beginning of third week, these side effects slowly start to develop and progress until the end of radiation. Even at the very end of treatment, most patients only experience mild to moderate rectal side effects. Very few patients have severe side effects. These side effects resolve over a few weeks. In general, the urination side effects resolve much more slowly than the rectal side effects. Now we discuss long-term side effects, which are side effects that happen many months to years after the radiation. In terms of the urination, some men may develop a urethral stricture. This is due to scarring of the urethra, which causes poor urine flow out of the prostate. This is a very rare side effect. There are surgical procedures that can be performed to restore the urine flow. Patients may also experience long-term leakage, which is a very rare side effect. If this develops, there are surgical procedures to help correct this. In terms of the rectum, some long-term side effects include an ulcer, which is a wound which can cause bleeding. Fortunately, this is a very rare side effect. There are procedures that can correct the bleeding. Some patients may also experience long-term diarrhea, which also is a rare side effect. Patients may also experience a decrease in sexual function. With surgery, the decrease in sexual function is due to damage to the nerves. With radiation, the decrease in sexual function is due to scarring and narrowing of the blood vessels that feed the penis. This results in decreased blood flow to the penis, which causes a decrease in sexual function. Most men can be given medication to help with their erections if they experience a decrease in sexual function from the radiation.